Hello, my name is Maxine Fong. I'm a physiotherapist from Perth Children's Hospital in Western Australia. On behalf of my team, I'd like to present the key findings from our scoping review of clinical functional outcome measures for children with cerebral palsy after gait corrective surgery. Gait corrective surgery has been considered standard of care to aid in the management of children with cerebral palsy by preventing the progression of secondary musculoskeletal impairments and its associated decline in gait and motor function. Traditionally, the focus on evaluating changes after surgery is in assessing gait impairments. There is a long-held assumption that by improving gait impairment, functional activity and participation outcome will also improve. However, this is not necessarily true due to limited use in literature of activity and participation measures to reflect surgical outcome. In fact, family priorities for undergoing surgery is not actually about improving gait impairment, but rather it's focused towards obtaining optimal functionality in daily life, for which measures are typically reflected as activity and participation outcomes. Further to this, in assessing gait impairment, three-dimensional gait analysis has been established as the preferred criterion standard to inform what surgery to carry out and also to evaluate changes in gait after surgery. However, it is actually uncommon in the clinical setting. So in its absence, physiotherapists revert to using other more accessible non-instrumented or observational gait assessments, but there is insufficient evidence and clarity as to which is the best one to use. So the aim of this scoping review is to identify the most frequently reported non-instrumented measures of gait, activity, and participation in children with cerebral palsy undergoing gait corrective surgery. This would then help direct further work towards developing a minimal core set of outcome measures for use in routine clinical practice. The scoping review included full-text articles that reported the effects of an orthopaedic surgical intervention on measurable gait, activity, and participation outcomes in children with cerebral palsy under 18 years of age. 4 engines were searched, generating 547 articles, and out of those, 44 studies met inclusion criteria. In regard to which non-instrumented measure of gait was identified, the Edinburgh Visual Gait Scale was the only chosen outcome measure. This is not surprising, as it is developed for use in children with cerebral palsy. It's most comparable to three-dimensional gait analysis. It has good psychometric properties, and it's sensitive to orthopaedic surgical intervention. Of all the studies including activity measures, 10 different tools were used. The Functional Mobility Scale was the most commonly reported measure. It discriminates children of different cerebral palsy classification levels, unlike the other activity measures, including the Gross Motor Function Measure and the Galette Functional Assessment Questionnaire. The Functional Mobility Scale has also been shown to have sound kinemetric properties and clinical utility. However, one limitation is that it assesses walking ability only over specific distances in the home, school, and community setting, and lacks evaluation of other functional activity in other contexts. Therefore, it should be used in combination with other clinical measures of activity. Out of the 15 studies that included measures of participation, the Paediatric Outcomes Data Collection Instrument, or the PODCI, was the most frequently used. However, due to its reported lack of responsiveness in orthopaedic surgery, there still remains uncertainty of the most suitable participation outcome measure. Therefore, work is still needed to identify a comprehensive suite of outcome measures for children with cerebral palsy undergoing gait corrective surgery. We can confidently state that Edinburgh Visual Gait Scale and Functional Mobility Scale should be included. There still needs to be focus on identifying other activity-based clinical measures to quantify the child's underlying skills and capacity, and performance-reflective questionnaires to identify how a child participates in real-life situations. Further research is also needed to report on kinemetric properties of the measures identified in the study, because frequency of use may not necessarily equate to being the most appropriate. Also, outcome measures should be standardised for use in children with cerebral palsy, and we must consider other relevant assessments validated for children with cerebral palsy that have yet to be the focus in orthopaedic literature. So a systematic review is now underway to appraise the clinometric properties of outcome measures identified in this scoping review, which would then make recommendations on the most appropriate measures to be used in the clinical setting, and therefore guide the development of a comprehensive suite of outcome measures for children with cerebral palsy undergoing gait corrective surgery. Thank you.